If you clicked on this icon, you would be interested in facial rejuvenation procedures. I'm Dr. Cohen. I'm a board-certified plastic surgeon. Facelift procedures and in general facial rejuvenation has become an increasingly large part of my practice as I've lost my hair and have gone gray, and as my practice and patients have aged with me over the last decade and a half or so. In fact, I'm seeing patients now for facelifts who have done their breast implants, and as I've gotten older, more and more people are concerned about maintaining their youthful appearance. And I think it's fair to say that as the baby boomers are getting older, we as a collective group are really trying to stay looking good because we are taking better care of ourselves than our parents did. Most of us, hopefully many of us, don't smoke. We've avoided the sun. We've taken medications which have maintained our blood pressure, we're indicated, and our cholesterols, and we're living longer and better lives. As they say, 50 is the new 30, and 60 is the new 40, and people want to really look as good as they feel. Facial rejuvenation surgery is becoming younger and younger, and the techniques are becoming better and better. Facelift surgeries, when I was a fellow, used to mean that you come into the hospital for several days and recover. Now it's all done as an outpatient. There are more sophisticated techniques for facial rejuvenation surgery, but I'd like to take you through some basic facial rejuvenation procedures in this segment of the videotape, and to educate you about the possible options, because when people come in and ask me for a facelift, that can mean many different things. The most common area of facial rejuvenation where people show their age is in their lower face and neck. Where people age is here, where they start to drop. People, as they get older, they tend to thin, and they get platysma bands, or the bands of muscle over here. People tend to jowl as well here. And when you're youthful, you have a straight jawline. As we get older, we tend to droop between the two ligaments which live where I'm pointing. Well, the surgery to correct that involves several parts. The basic lower face and neck lift, which can be done under sedation, under local anesthesia even, or under general anesthesia if it's combined with more surgery, typically is going to involve incision around the ear, which comes in front of the ear. It can go behind the tragus, which is this piece of cartilage, or stay in front of it, comes up and around the ear, behind the ear, and typically into the hairline. And that really depends upon the degree of neck excess that one demonstrates and how old you are when you get your first procedure. Most facelifts are going to last 8 to 12 years if you don't smoke and if you haven't had a lot of sun damage to your skin. The younger you are, typically the longer it's going to hold up. The facelift, the lower face and neck lift specifically, has usually 3 components. People think about removal of skin, but in my view, that's the least important aspect of it. Removal of fat from the neck, where appropriate, is done with liposuction. And the most important aspect of the procedure is tightening up the facial muscles. That includes the platysma muscles in your neck and the SMAS, or the layer of muscle of your cheeks. Very important to know from my practice that facial rejuvenation surgery should yield a person, you, that looks like a youthful you, not somebody who is a different person. If you're looking for that, I'll tell you where you can go. Not in a disparaging way, but there are people, particularly in the West Coast, who will give you a much more aggressive facelift from here up and will change the way you look and make you perhaps look like you've never looked. And that may be okay and desirable for some people, but not what I prefer to achieve. I will leave you with a very nice and lovely neckline. In fact, some people will get necklines that they've never had based upon the muscle work that I do and the fat removal, but I'm not going to leave you with a windblown, overly tightened cheek. I'd rather come back and take out a little bit more skin and tighten you up to leave you than to leave you for 2 years or so looking tight with my name on your face. That's not what I'm looking to do. The scars are typically fairly minimal from the lower face and neck lift, and usually easily camouflaged with makeup and hairstyles. The only scars that are typically at all visible are the ones behind the ears, and that is often easily camouflaged with even the easiest hairstyle to maintain. That's true for both men and women, and men are increasingly seeking out facial rejuvenation procedures as there's no premium anymore for gray hair or bald heads in this era of the digital age, where youth is at a premium and age is not so much so anymore. So facial rejuvenation is a pretty easy procedure to recover from. It's done as an outpatient. Most of my patients are back to the public eye within 10 to 14 days after the surgery. Bruising can be there, but usually it's fairly limited with the use of the tumescent technique, which is the same thing we do for liposuction, where we actually instill large amounts of Novocaine mixed with salt water and adrenaline in your face before we start to really reduce the postoperative bruising. What are the risks of a lower face and neck lift? It's important to know. Wound healing problems can occur. They're much greater in people who smoke. While I won't play your clergy person, I will tell you that your risk of wound healing problems is 4 times greater in smokers than in non-smokers, and you're taking a much bigger risk if you smoke. That includes all nicotine products, nicotine gum, nicotine patches, and tobacco of any variety. So for those patients who are willing and wanting to undergo a facelift, I strongly urge you to quit. There are many new drugs in the market, such as Chantix, which is a great drug to help you stop smoking, and I encourage people to really get off the habit before they go on and change their life for the positive. You can lose feeling to your ears, which can be permanent. You can get a facial nerve injury, which can leave you with an off smile, a crooked smile. It can leave you with inability to raise your brow. Very rare. Most of the time that's transient or fleeting in nature, but it can take several months to go away. Wound healing problems, again, can occur as well as hematoma or collection of blood. That is much more common in people who have high blood pressure, which is why we take great pains to make sure that people's blood pressures are well controlled before surgery. And even if you are taking your medication, we will often supplement it with additional drugs to keep you particularly low around the time of surgery. And if you've never had high blood pressure, we still may give you something to maintain your blood pressure to reduce the risk of bruising and postoperative bleeding. Patients will go home the same day wrapped up. They'll come in then typically the next day into our office. We'll wash your hair. We'll make sure everything's okay and send you home. Suture removal is done at a week, and then again further at about 10 days for areas of greater tension behind your ears. And again, most people are back to work in around day 10. It takes about 3 months to get over the lower face and neck lift, and it really takes people that long to get over the psychology of having had their face altered. You'll still feel swollen, your neck will feel tight, and that's pretty common. Also of interest is that statistically about 60 to 70% of patients will get a little bit depressed after facial rejuvenation surgery or any facial surgery. That it's helpful to know that occurs, that it's not